Good afternoon, Dragon Media, following Tigray War update online, March 14, 2021. Today's report will focus on the health crisis in Ethiopia's war rival, Tigray. This report is basically on an article published online by Fisah Tesfai and Haile Geseso. It's now over 4 months since the fighting between Tigray regional forces and the Ethiopian National Defense Forces, along with Amhara Special Force, Amhara Militia, and Eritrean Defense Forces, broke out in Tigray. The entire Tigray region has been mostly cut off from the rest of the world during the war, creating an information vacuum regarding the true nature and scale of the humanitarian crisis in Tigray. To determine the extent of damage to the health infrastructure, Fisah and Haile conducted an unstructured interview with an official of the Regional Health Bureau dispatched to assess the situation in the Tigray region in February. In addition, media releases by various international organizations, including the United Nations International Children's Emergency Fund, World Health Organization, and Medicine Sans Frontiers, were synthesized. Health system impact. About 80% of patients who made it to hospitals in the Tigray region had trauma-related injuries in December 2020. However, in 21 out of the 40 hospitals that were assessed by the Regional Health Bureau, only 11 hospitals were functional. 6 were completely demolished. 9 were partially functional, and 1 was turned into a hospital that serves military personnel only. Similar situations were reported when it comes to health centers, hospices, and ambulance services. Almost 85 to 90% of health centers were non-functional, and about 90% of ambulances were either destroyed or loaded. A summary of the damage to the health infrastructure by zone is present as follows. Eastern Zone Health Facility Status. Adigrat Hospital is completely demolished, and equipments have been loaded or burned. Currently, only 10 out of 400 health workers were working at the hospital. Fati, Fraueni, and Hausen hospitals were loaded, and they are currently non-functional. Addis Pharmaceutical Factory in Adigrat was completely demolished and loaded, and now it's out of order. Southern Zone Facility Status. The status of Alamata and Korum hospitals is unknown. They are under control of the Amhara militia. Maicho Mohoni, Adishu Adigudam, Kuiha hospitals are open during the daytime only. Although they suffer from the shortage of supplies and salaries for health workers, they still provide limited service, including obstetric care, such as delivery. Maqala Health Facility Status. Either Referral Hospital, Maqala Hospital, and 10 health centers were closed at the beginning but are slowly being opened. They are currently working at 30 to 40% capacity. From 3 November 2020 to 4 February 2021, ambulances were not allowed to operate between 6 p.m. until 6 a.m. due to curfew. Starting from 5 February 2020, ambulance service will not operate between 8 p.m. to 6 a.m. Central Tigray Health Facility Status. Adwa and Abiy Adi hospitals and 3 other primary hospitals were also completely demolished, and another hospital in Abiy Adi was turned into a military hospital. Civilians are banned from using it. Aksum hospitals provide 10% of its capacity due to shortage of logistics and attrition of health workers. Western Tigray Health Facility Status. Salaklahash, Suhul, Shararo hospitals were looted and destroyed. Northwestern Tigray Health Facility Status. At the time of reporting, the status of the healthcare system was not known because the area is under the occupation of the Amhara militias. Healthcare workers were either displaced, killed in the war, or had their services terminated because of protracted unpaid salary for the last 3 months. This has led to the collapse of the health extension program, a pillar of the health system in the region. Malnutrition. About 75% of the regional population, approximately 4.5 million people, of which 2.2 million are children, are now food insecure and in need of immediate humanitarian assistance. While the short-term effects of malnutrition are death, failure to thrive, and stunning, severe acute malnutrition adversely affects educational performance, intellectual development, and broad economic parameters. Outbreaks. While existing outbreaks such as COVID-19 are likely to worsen due to the war, the collapse of the primary healthcare system and disease prevention activities mean the outbreak of other infectious diseases, including malaria, measles, cholera, and yellow fever, may re-emerge. Sexual violences. The conflict in Tigray has also led sexual violence and abuse, including rape cases. 108 rape cases were reported in an assessment by the Ethiopian Human Rights Commission in the southern Tigray and Mekelle. These women are at risk of serious physical and mental health complications, including unwanted pregnancy, sexually transmitted illness, post-traumatic stress disorder, depression, and suicide. The way out. The key to addressing the complex health challenges due to the war in Tigray are: the international community should put continuous pressure to stop the fighting. 2. Immediate withdrawal of the invading in Amhara and Eritrean forces from Tigray. 3. Immediate withdrawal of the Ethiopian army since it's committing atrocities on its own end, together with the invading forces. 4. Allow life-saving medical teams and equipment. 5. Allow unhindered access to humanitarian aid, such as food, water, and shelter. 6. Establish mobile satellite clinics. 7. Rebuild the healthcare system. This will require reconstruction, rehabilitation of physical health facilities, health posts, ambulances, roads, communication infrastructure, the restocking of drugs, and medical supplies. Thank you for listening. Share, subscribe, and be kind to everyone.